A very good evening to everyone present over here. I'm Samparna. So this session is for the IIT Kharagpur Alumni Foundation of India, and the topic is urogenital health. And we have a speaker, Dr. Harsh Aggarwal, for the same. And I hope you guys like the session. And let's begin with it. Dr. Harsh, up to you.
Thank you. Thank you so much, Sabarnaji, for the genuine introduction. Good evening, everyone. I hope everyone is doing well. I'll start by sharing on my screen. Uh, just give me a moment. So I believe it is visible, right? Samparnaji, can you just tell me, is it visible or not?
Yes, Dr. Harsh, your
Yeah.
screen is visible. Yeah.
Okay, that's great. So our topic today is urogenital health, and we will be discussing about this topic in brief detail, what this topic is and what are the health issues commonly faced by us in the Indian society, usually in the urogenital system, and how we can tackle about all those things. So the session will be of around 45 minutes, and thereafter we will open the session for the Q&A, where you can ask me any questions related to urogenital health in either in the chat box, or you can just unmute yourselves and then ask me directly as well. In between as well, I have kept certain quizzes as well, like one quiz is there, I believe. So I hope that everyone will participate since the screen will be on. So I would request anyone who wants to answer to the quiz questions, I would request them to answer by unmuting themselves. So let's start with the presentation. Understanding urogenital health. So first, as a quiz only, uh, understanding the genitourinary system. So what do you mean by this genitourinary system? Whenever I talk this genitourinary, what system is this? Can anyone answer? You can unmute yourselves to answer. It's completely fine. I won't judge even if you answer wrong. It's completely fine. What is genitourinary system or urogenital system according to your knowledge? Anyone? Nobody knows, or everyone is feeling shy? Please unmute yourselves. Please feel free to answer. What does the term means? Like, what is your knowledge? See, I just want to know so that I know where is your knowledge and where do I have to add on to your knowledge. So please, what does this term mean, genitourinary system? Anyone? Okay. So I believe nobody wants to answer. So genitourinary system, we will discuss about this. Genitourinary, these two are the different components. One is the genital system, genitalia or the external genitalia or the internal genitalia of the male and the female, the genital organs. While the urinary system, which includes the kidneys, the urinary bladder, the urine tract, that is a genito and urinary system. Since they both are present in the same way, on the same passage, that is why we have clubbed this together, urogenital health or genital urinary system. My second and last question, since I believe that nobody's participating, so the last question for this quiz is, what do you think is the most common diseases associated with the genital urinary system? Can you name some diseases? Any diseases you might have heard amongst your family members, your friends, your colleagues? Somebody might be saying, "Okay, I'm having this problem." What are the common diseases which you have heard of these genital urinary system?
Dr. Harsh, there is an answer in the chat box saying prostate cancer.
Okay. Well, that's correct. Prostate cancer is one. That's really correct. Any other answer apart from it? What other
Enlarged,
diseases?
enlarged prostate.
Enlarged prostate. That's also right. That's also right. Any other diseases which you can think of in the urinary system, in the genital system? A very common amongst Indians, we all eat a lot of masalas. So in the urinary system related to kidneys,
Kidney stones.
kidney stones. Yeah, that's good. That's really good. The most common of the urine problem is either kidney stones or another one is the infection. So Thank you so much for answering. So let's start with the presentation. So this is a genitourinary system. Here towards the left-hand side, you will see that this red part, the red inside the blue, this complete is the urinary system. This is the kidneys, this is the ureter, and then the urinary bladder. So this is entirely the urinary system. While on the right-hand side, you can see that this is the genital system. The above picture is of the female genital system. Here you can see, I hope you can see my arrows. So this is the uterus, these are the ovaries, and this is the vagina. So this comprises of the female genital system. While in front of it, you can see just here in front of it is a urinary bladder where the urine gets stored. After the kidneys, here the kidneys have produced the urine, it will get stored in the urinary bladder. So this is the urinary bladder. And same is in the males. So in the males, here we can see that this is the penis, this is the testis, where the sperms are produced, and here it goes alongside along the pathway of the way the urine goes. So this is how the male genital system and I'm so sorry, the male genital system and the female genital system looks like. Now, what are the common genitourinary disorders? Now, since somebody has already answered some of the diseases, and that is really very correct. Kidney stones is one of the important disease. Another one is urinary tract infection, the kidney infection, the urine tract infection. It is also another second common disease in the genitourinary system. Other diseases are infections like genital infections, sexually transmitted diseases like HIV, hepatitis, chlamydia, gonorrhea. All these comes under the umbrella of STDs, sexually transmitted infections. Then the cancer, somebody already mentioned prostate cancer. Then we will also talk about unhealthy periods. Since the normal periods are okay, but if you have unhealthy periods, we'll come to the definition when it is called as unhealthy. So that's when we need to see, and this is a common disease as well. Now, the first one is urinary tract infection. Infection which is present in the kidneys or the urinary bladder or in the ureter or the urethra, anywhere in the urine system, that is called as urinary tract infection. So what will be the symptoms we will all feel? Number one will be problems in the peeing. Whenever we are going to pass the urine, we will feel there is a burning sensation. There is some pain while passing the urine. We will feel that there is a pain in the lower abdomen as well, pain in the side of the abdomen or the back as well. Apart from it, there is smell coming from the urine. There is cloudiness of the urine. Somewhere you might have heard some old ladies might be complaining to you that, okay, my urine is cloudy in nature, some frothingness is there, bubbles are there. So that is when it is called as they might have urinary tract infection. And what are the risk factors of the UTI? What are the risk factors of the urinary tract infection? So number one, obviously, if you are not maintaining the hygiene, so there are higher chances of getting contracted with an infection. So this is the most common cause for the urinary tract infection, to not maintaining the hygiene. Apart from it, there are other secondary factors as well, like pregnancy, menopause, chronic health conditions, sexual activity. So all these also concurs to the UTI. Now, how can we keep UTIs at bay? We all don't want those urine problems whenever we're going to urinate. We don't want burning sensation is there, because that just irritates as well. That just causes pain as well. So how to keep these UTIs at bay? So if somebody has contracted UTI, the number one and the most important treatment is water. Hydrating yourself with the appropriate amounts of the water on daily needs. That's gonna keep any infections related to the urine away. So hydrate yourself. Here, I want to mention another point. By hydrating yourself, how much of the water should we drink in one day? Like as an adult, as me, or I believe most of my audience is adults only. So how much of the water should we drink, especially in the summer seasons? It should be 4 liters of water in a day. At least 4 liters of water should be there. While in the winters, 2 to 3 liters of water is good enough. So that is the water intake one we should consume. Then after whenever you are having sexual intercourse with your partners, always try to urinate before and after having sexual intercourse. That will really help to prevent any kind of infections, even certain STDs as well at bay. So always try to urinate before and after sexual intercourse. Then obviously maintaining the personal hygiene using intimate washes. Intimate washes are now available as well. So using intimate washes for personal hygiene, wearing the cool and not cool. I meant like not sweaty underwears, undergarments. Whenever you are having some sweaty clothes around your genital area, that is another source of the infection. So always try to change out of them. Use contraceptives before during sexual activity. So all these are the way how you can keep UTIs at bay. Next, we come to the second topic, that is kidney stones. How will you diagnose somebody is having kidney stones? Their number one problem will be pain. So pain here in the picture on the right hand side, you can see that there is a pain on the flanks region. So this is the side of the abdomen. So this area you will get the pain. Apart from it, there is pain on the lower back, pain in the front as well. So this is the most common complaint of the person who is having kidney stones. Secondly, they might sorry, they might also complain that they're having pain while peeing as well. While urinating, they are having pain. Then there are other complaints as well. There is blood in urine, there is cloudiness in urine, there is foul smelling urine, unable to pass the urine, nausea, vomiting can be there. So these are the other symptoms of the kidney stones. Now, these are the different types of the kidney stones. Hey, I mentioned earlier when somebody mentioned kidney stones, why the kidney stones are caused? It's because of all the salts we are intaking, the kind of masalas we are having. Somebody who is consuming too much of masalas at home, as an Indian, we all consume too much of that. And even I would say like consuming too much of nuts, too much of seeds also induces kidney stones formation. So if somebody is having kidney stones, try to avoid the masalas, the salts, any kind of salts, the fruits which have stones, like bananas, uh, bell peppers. So they all have stones, okra, bhindi, they all have the chances to create the stones. And these are the different types of the stones which can be created in the kidney: calcium stones, uric acid stones, cystine stones, struite stones. These are all the types of the stones which can cause kidney stones. Now, there's a common, whenever somebody is coming to my clinic with kidney stones, they ask me, okay, sir, what diet should we take? What should we avoid? So this is a slide which I have kept. So this is a diet one should take to avoid kidney stones, to prevent kidney stones. So they can obviously water, as I said, water is the beneficial, the most important meal, most important food in the diet to prevent any kidney diseases. So water with lime, lemon, orange slices or juice, anything. Apart from it, certain green vegetables like kale, broccoli, low fat yogurt, milk, all these really help. While we should avoid any processed foods, any cold cuts, or salty, sugary foods, the McDonald's burgers, all those fried foods as well. Apart from it, these are the oxalate rich foods. We have seen that oxalate crystals can be formed as well. So these are the oxalate-rich food items which we should avoid. Nuts and the seeds, as I mentioned, seeds also causes kidney stones. So nuts and the seeds should be avoided. Beans, buckwheat, raspberries. So these all should be avoided to prevent the kidney stones. Next, we come to the infections. Now, here I've divided the slide into the two parts. Number one is the vaginal infections, and there are three most common vaginal infections. One is the yeast infection, another one is bacterial infection, and trichomoniasis is another bacterial infection. So, what will be the most common complaint? If there is any female present in this during, like amongst the audience member, they might relate that they might relate this thing, some kind of discharge occurring through your vagina. Some discharge is pretty normal unless and until its color has changed, the odor is there, then it is abnormal. So white discharge, which is odorless, which is not sticking as well, so that is very normal. If the color of the discharge has turned yellow, greenish, curdy, like dahi ka texture jaisa hota hai, the color of the curd, yogurt, so those are the colors which will represent, okay, you might have certain vaginal infections. Apart from it, if you have foul smelling as well, so that will indicate that you have I'm so sorry, I'm just having cough. So bacterial vaginosis can be there if you are having some foul smell as well. So these are the common infections when you can see whether your vaginal discharge is normal or not. Apart from it, there are other features as well, but no need to get into the detail. If you're having any of these infection, of course, go to a gynecologist and see yourself, and they'll prescribe you certain medications and use intimate washes as well. Even with using intimate wash on daily basis, it will get cleared out. Next, we come to the sexually transmitted diseases. We all have heard of HIV, hepatitis, all these diseases, syphilis, gonorrhea, human papilloma virus. We'll discuss about this later. The most common, or I would say the most common amongst these is syphilis. Syphilis is that much common that it occurs 1 in 1,000 people. Let's say if we are having 1,000 people anywhere, so almost one person will be having syphilis at that point of time. So syphilis that much common in Indian scenario. Apart from it, HIV and hepatitis are those ones which require I'm so sorry. HIV and hepatitis are those ones which require lifelong treatments, and that is why they are being stressed upon. And they can also be fatal as well. Since human immunodeficiency virus, HIV, the full form is human immunodeficiency virus. So that means one which is the virus which gets into the humans and causes deficiency of the immunity, and which will ultimately leads to fatality. That is why HIV is very stressed upon. Again, herpes simplex virus is there, chlamydia is there, gonorrhea is there. Human papilloma virus is also common. This causes cervical cancer, which we will discuss in the later slide. Now, how vaginal infection affects the body? So these are the common, common symptoms we can see when somebody is having vaginal yeast infection. Discharge, as I have talked about, burning while urinating, burning sensation or pain during urination, pain during sexual intercourse, itching might be there. So these are the common symptoms of the vaginal yeast infection. Next, we come to the STD symptoms. Low immunity fever is common amongst almost every STDs as well, apart from HIV, since HIV is itself low immunity itself. Then next, swelling, genital swelling, you will see that there is a lump in this part or in this part, like near your neck or in the genital area as well. These are the most common symptoms, and other symptoms can be rash, yellow eyes, discharge. These are the other common symptoms. Now, how can we prevent sexually transmitted diseases? Obviously, abstinent from having sexual intercourse using contraceptive devices like condoms while having the sex, because condoms do prevent transmitting of the infections as well. Choose your partners carefully. Here, I want to tell you about a case study which we have done during my time. A lot of truck drivers, what they do is, I'm so sorry. So a lot of truck drivers, what they do is whenever they travel, they do sexual intercourses with random people, and they are the major source of transmitting infections. And that is why choosing partners carefully is very important. If you are practicing polygamy, so always choose your partners carefully. Get checked for STIs regularly. Obviously, there are checking options now in the blood centers as well. Avoid alcohols or drugs. Learn the signs and symptoms as you've already learned. Next, we come to the prostate cancer. So prostate cancer, somebody has said enlargement of prostate. So the prostate is only the part of the male. It is not present in the female. So prostate, anything which is related to prostate can occur in the males. And enlarged prostate is most common, is that much common that in the Indian scenario, almost 90% of the males after the age of 70 or 65, they usually get their prostate enlarged. This happens because of our genetics. Then apart from it, our hormones like testosterone. So the prostate gets enlarged by itself. So this is like 90% common among the male. But whenever the enlarged prostate can cause other problems, or it can turn into the cancer very commonly when your age gets on higher, more like 70, 75. So it can get also like converted into a prostate. And what will be the common symptoms? So you will feel that during the night, you are having certain urges to go to the washroom. Like बार बार वॉशरूम उठ के जाना है, बार बार जाना है, रात के टाइम पे उठना है. This is the very I hope everyone is comfortable in Hindi as well. I'll say in English. So you have this urge on passing the urine more often than usual, especially at night. You'll feel, okay, now I have to go again, now I have to go again, like 4 or 5 times in the night only. You'll also feel difficulty in passing urine. You will feel that, okay, I have passed urine, but my bladder is not empty. I'm still having this urge to pass the urine again. then needing the rush that you are feeling, okay, if I'm not going to the washroom right now, then I might lose the urine on the way itself. These are the most common symptoms of the prostate cancer. I'm so sorry. I'm just having a really bad cough, and that's why I need to take some breaks. Now, how can you keep your prostate healthy? Obviously, eating healthy, doing exercises. This obviously leads to, in general, any kind of diseases at bay. So, obviously, eating healthy and exercising is one thing. Quitting smoking, alcohol, getting regular checkups. These are the other ways how you can keep your prostate healthy. Next, we come to cervical cancer. Cervix, just like prostate, cervix is a part of females only. So here you can see as this is a diagram of the female genital system. So this is the uterus. Here, the lower part is the vagina. The one thing which connects the uterus and the vagina, this is a very, a 2 centimeter part. This is called a cervix. So this is this chotu sa part, a smaller part here. This is called a cervix, and this above is the ovary. So here in this picture, you will see this is the opening of the uterus, by the way. So, and this part has been enlarged over here. So here you will see that the red part is the normal part, while this excoriated part, the ulcerated part, this abnormal looking, this is called as cancer. Whenever there is some abnormal growth, that is when it is called as cancer. And what will be the common symptoms? Vaginal bleeding between or after menopause, irregular bleeding, I would say in any time. Once you have reached menopause, before that, after that, then in between the periods, bleeding during the intercourse. So these are the common like symptoms of the cervical cancer. Then you might also have pain as well, pain in the pain during sexual intercourse, pain in the flanks, pain in the back, pain in the abdomen, pain during urination as well. Weight loss, you might feel you will feel okay. You have become anorexic. You are not feeling hungry. So these are the common symptoms of cervical cancer. And this slide is very important, I would say. I would say to take a note of this slide as India, the government of India has launched the cervical cancer vaccine this year only, sorry, last year only, and which is called the Servavax. So the government of India has launched this vaccine because cervical cancer is one of the most common cause of cancer death in the female in India. And that is why we have launched, like, government of India has launched this vaccine. It is available in government sectors, private sectors, almost everywhere. In the private sectors, the cost is around 2,000, 3,000, depending upon where are you getting it from. But in the government, it is free of cost. And this is the schedule. I'll be talking about the schedule. So if you have your daughters, if you have your sisters, if somebody amongst this age group up till 26, so please get them vaccinated in your home. Let it be guy, let it be female, anyone who are between 9 to 26 should get vaccinated. So let's say if your kids or if you are having the age of 9 to 14 years, so this age group will get 2 doses of the vaccine, one at 0 month, another one is 6 months. So let's say today you get the vaccine, then after 6 months you will get the vaccine. So make sure you are getting HPV vaccine for your daughters, you're somebody who is aged 9 to 14 years. Then if your age is 15 to 26 years, then 3 doses of HPV vaccine is there, 0, 1 and 6 months. So one you get today, thereafter 1 month, and thereafter 6 months. So this is how HPV vaccine works. While for the males, so age from 21 to 26, vaccine is offered. Vaccine is offered means that you have to go and ask. That they won't provide itself, but you have to force. You have to tell them, okay, I want my male child, I want myself to get vaccinated. So here again, the 3 dose regimen, 0, 1, and the 6 months. So this is the schedule. 27 to 45, this is not recommended, so I wouldn't mention this one. So if anyone in your family is aged between 9 to 26, please make sure that you are getting vaccinated as well for the HPV vaccine. As I've already mentioned, human papilloma virus is the most common cause of cervical cancer. Like 99% of cervical cancer is caused by a human papilloma virus only. And human papilloma virus is already present in our bodies, already present in our genital system. It just gets active and cause cervical cancer in some individuals whenever the immunity is low, and we don't know when our immunity will get low, right? So why not to get vaccinated? Next, we come to the cervical cancer screening guidelines. So I also want to stress on this one, as in the USA, UK, Dubai, almost everywhere outside India, like in the progressive countries, they all have these cancer guidelines, which they have to mandatory follow. But in India, we have stuff like cancer guidelines, which we have to follow, but we don't know about those. So there are only three cancers which have like guidelines: cervical cancer, breast cancer, and rectal cancer for the rectal cancer, not rectal cancer, oral cancer for the males. So here, since cervical cancer is our topic, so cervical cancer screening guidelines are there. This is also being authorized by the government of India, and we should all know this. So let's say if your age is 21 to 30 years, and after marriage or like after having sexual intercourse, we should always go for pap smear. Pap smear is kind of a test to detect cervical cancer. This is being, made up by government of India itself. So pap smear should be done once every 3 years. If your age is between 21 to 30 years and you are sexually active. If your age is between 30 to 65 years, so you can get pap smear done every 3 years, or you can get pap as well as HPV every 5 years. So you have two options between when your age is between 30 to 65 years. So this is very important because if you diagnose the cancer early, so you can get chance of getting treated early as well, and there are higher chances that it won't cause anything. But if you are not getting diagnosed early, so obviously it will cause other problems as well. And once your age reaches 65, if you are more than 65 years, so there is no need of testing. So 21 to 30, pap smear once every 3 years, 30 to 65, 3 years or 5 years, your choice. So next we come to normal menstrual cycle. How does a normal menstrual cycle looks like? So first of all, let's talk about the cycle length, the entire length of a cycle. So like we all know from our mothers, from our, from somebody, our female idols, they have told us that 28-day cycle is normal. But, I'll just add on something here. 21 to 42-day cycle is normal. If your cycle is like, let's say if it is coming after every 21 days, it is normal. If it is coming after 42 days, it is normal. If it is less than 21 and more than 42, then it means it's abnormal and you need to see a gynecologist. Okay, I'm so sorry. Yeah. So this is about the cycle length. Cycle length is 21 to 42 days. Next, we come to how does a normal period look like, the bleeding days. So bleeding days here, it's mentioned the wrong date. I don't know, like, I just got this from some website. So the data is a normal period will last from 2 to 7 days. So if your bleeding is from 2 to 7 days, it's completely normal. If it is more than 7 days, then obviously it is abnormal and you need to see some gynecologist. Next, we come to the color. Color should be like fresh red. So color can vary as well. Color can be fresh red, cranberry red, dark red as well. But make sure that there are no odor. There are no major, some bigger clots. Smaller clots can be present. It's very normal. But the bigger clots, I would say 3 centimeters, more than 3 centimeters, that means it's abnormal. You need to see a gynecologist. And if you have a odor, if you have foul smell from your period blood, that means you have some infection side by side as well, and that might also lead to miscarriages, not getting pregnant. So these needs to get checked. And what about the blood volume? Blood volume should be 50 to 80 ml. This is around 1/4 of a cup. So a classic coffee mug, 1/4 of that. So that is blood volume. So a normal menstrual cycle length is 21 to 42. Bleeding days or the period days is 2 to 7 days. Color can vary. No larger clots or odor, and blood volume should be 1/4 of the cup. If anything abnormal than this, then that means that you are having some abnormal menstrual cycle. You need to get it checked by the gynecologist. And this is how you will keep your menstrual cycle or the menstrual hygiene. You should change your sanitary napkins every 4 to 6 hours. Otherwise, it will start having infections. Wash your undergarments properly. Discard sanitary napkin properly. Do not hesitate in discussing it. And keep yourself clean. Of course, hygiene is something, which we all strive for. So overall conclusion, how can we keep the overall genital urinary tract infection at the bay? Clean your genitals before and after having sexual intercourse. Hydrate yourself, urinate, drink lots of the water, and wash your areas, and obviously don't hold your urine. This is a very common practice. Like if your office job, I don't know what's your work profile, but anyway, if your office job, if your job demands, like our job as a doctor do demands to hold urine, but we try to not to, because holding urine itself causes kidney stones, urine tract infections. So try to not to hold urine. And that's the end. And I'll open the session for the Q&A. If you have any questions, so please feel free to ask. I'll be happy to answer your questions. If you have any questions, please feel free to either ask me directly by unmuting yourselves, or you can write it in the chat box as well.
Doctor, UTI is also seen for kids, very small kids, like kids in the range of 3 months to 6 months. Uh, because my son had when he was very small. Now, what is the reason for having it very small kids, infants?
In current society, in today's days, I would say rather, it's a very common practice. Just give me a moment. Yeah. It's a very common practice that we use diapers. Like whenever we are going outside, whenever we are at home as well, we generally use diapers for our kids. And those diaper itself causes rashes, first of all, the rashes in the thighs. And secondly, it itself causes UTI. Apart from it, secondly, the children are all itself prone because they have not developed the immunity. Why do we suggest that, okay, we should, like, whenever somebody has been born, they should be breastfed exclusively, no water, no honey, nothing to be given for 6 months, because this breast milk is causing to for the child to develop its immunity. And if the immunity has not developed, then there are higher chances, while they're passing the urine, there are higher chances that they might get contracted with the UTI. That these are the two most common reasons why the children of the age 1 to 6 months, or the infants, they usually contract UTI.
Many times, like you are telling, totally mother's milk, but many times there may not be enough milk. So they are maybe dependent on external milk or water. Or external milk.
Yeah, I completely understand. Considering our diet today, the mothers, they are not intaking, proper nutrient-rich RDA recommended balanced diet. And that is why the breast milk itself becomes insufficient. And whenever it is there, then obviously we need to go for the supplemental breast milk, like solutions which are available in the market. But we should try for as far as possible. According to us doctors, we usually tell the breastfeeding mothers to exclusively breastfeed for 6 months, to not to give any water, anything from outside sources, just give breast milk if possible. And after 6 months till 2 years, do breastfeeding as well, side by side, do other things like intake of water, intake of other food materials as well can be started whenever the child starts swallowing as well. So these can be done after 6 months if it's possible.
Two more questions, doctor.
Sure.
Now, UTI I have also seen in a very senior lady, means age 65 years and above. And unfortunately, after UTI, she was admitted in hospital, and after treatment, she expired. This is one. And question number two, prostrate you've told for male above 65. So, what care needs to be taken for males so that the issues of prostrate are less? That you kindly tell.
Uh, I'll tell about the prostate question first. Later on, I'll come to the second question because I didn't get your first question. What is your question basically you're asking? So about the prostate, the usual age is 60-65 after you start having enlarged prostate. And how you can keep your prostate healthy is by keeping your genital area healthy, first of all. As more as you get the UTI or any kind of infection, so the inflammation will start, and the inflammation itself will affect the prostate, and which will start getting enlarged as well due to the inflammation, and itself cause enlargement of the prostate. Secondly, I'll tell you to hydrate. Hydrating, as I've already mentioned, that any kidney problem, any genitourinary system, obviously hydrating is something which we should not forget. So hydrating and the diet and the exercising. Diet and exercising itself, eating high fibrous diet. As you age, if your age has reached 50 or 55 years, your diet should be 30% of fibrous foods. That will help you in digestion as well. Uh, Before that, we can digest almost anything. But if you have reached more than 50 years, you should always consume 30%, 40% of the diet should be a fibrous foods. So start intaking that. Go for the exercises, go for the walks, go for the running, and that will itself help to prevent prostate. And smoking is something like which we have seen that 30% of the prostate cancer people do smoke, and which we have related that smoking itself causes prostate cancer. So obviously, quitting smoking is the one. Uh, can you please repeat your first question again? I
Yeah,
didn't
my
get.
first question
Lady
was
was.
about, like you told that what I saw, there was vaccines still, I think 45 years for females, after means 25 to 46 or some age, last age group. Now if somebody in the age of 65 and above gets an UTI, because I understand there is no vaccine, so uh, so that other than the hygiene factors, is any other care to be taken for women who are above 45 years?
Again, I would say the same. Hydrating, hydrating, hydrating. There are three answers, just the hydrating, hydrating, and hydrating. Hydrating yourself, I have told 4 liters of water in summertime, 2 to 3 liters of water in the winter time. It itself causes a lot of kidney problems away. And somebody who's having UTI, like I have seen my great grandmother. She was, I think she was 75 or 76 when she got contacted with the UTI. And I just told her to just drink water, lots and lots of water. And she just got fine within 1 or 2 days only. So obviously hydrating, then keeping your diet, maintaining the hygiene itself, that's it. Apart from it, there are medications as well if you have contracted UTI. But again, you need to discuss it after having your urine test done.
Thank you.
All right. So somebody has asked, what are pros and cons of alcohol? Uh, so alcohol pros. So pros. Okay, I'll talk about the cons first. There are a lot of cons, which we have already heard itself causes liver cancer. Any kind of liver problem is associated with the alcohol. Since alcohol, whenever we are ingesting the alcohol, it goes into our stomach, and the stomach itself can like have that alcohol for 4 to 5 hours. Thereafter, liver starts working on that alcohol, and whenever liver starts working on that alcohol affects the liver cells and it damages the liver cells. And that is why the stomach and the liver are the primary organs which are get affected by the alcohol. There are obviously other causes of the alcohol as well. We might get other sort of cancers, lung cancers, bronchial cancer, esophageal cancer, other problems as well, lungs problems, stomach problems. You will feel a lot of bloating, acidity might be there. About the pros now. So I have to think of the pros. Of course, a few pros are you will obviously, whenever somebody is having some mental issues, whenever they are stressed or depressed, they will feel a little away from those areas. And there is a higher chance that it can turn into a cone as well if you're not intaking it, you know, uh, on a behaved manner, I would say. So obviously that is something which I feel a pro. Apart from it, it also helps in keeping one thing away, that is the kidney stones. Any kind of stones, gallbladder stones, duodenal stones, kidney stones, since alcohol itself causes us to urinate, and that is why alcohol is prescribed. I would say like beer is the most common alcohol prescribed during kidney stones, but it is no longer prescribed in these times since we have a lot of medications available. So yeah. Any other question somebody wants to ask? Please feel free to either write in the chat box or you can just unmute yourselves as well. Does anyone have any other question? So I believe nobody has any questions. So let's conclude the presentation. Thank you so much for being today. Okay. Somebody has asked something. Taking water while standing is not advised. Uh, that is not advised usually because the while we are standing, what happens is everything is aligned in one direction. So whenever we are intaking water, we all know physics, the gravity itself. Whenever we are intaking water, so the stomach does not get the hold of that water, and it passes on and passes on and passes on. That is why the nutrients or the other things which gets washed away as well. And standing itself, it causes, in some textbooks, I would rather not agree with that. But in some textbooks, it says that while the water is being passed down, it gets uh, it gets collected up in the joints and causes joint pain. And that is why it's not advised. But there is no scientific evidence for this to say. There is evidence that water gets passed, yes, a little bit amount, but not too much. And I wouldn't say that it causes too much harm, but obviously Ayurveda medicine itself says it. So I respect that medicine as well. And I would also say, okay, you should not, when some textbooks of some medicine are saying that. Thank you for the session. It was informative and useful. Hope to do it again. Yeah, for sure. For sure, I'll do it again. Uh, I believe nobody has any other questions. So thank you so much for giving me this opportunity and for telling you all about the health session today. And I believe you all will take care of your health in a good way. And I wish you all a good health. Thank you so much.
Thank you, Dr. Harsh, for the joining and for this informative session. And thank you all the alumni of IIT Kharagpur for making this session a successful. We'll meet again soon with a new topic and with a new healthcare uh, topic for you all. Thank you everyone for joining. Thank you so much.